I'm here. Is this better for you?
Yeah, so far it's better. Yes, we'll let you continue so that we can make sure we hear everything you're saying. So
say that again. I'm sorry, you cut out.
Yeah, well, this is the joys of modern technology, right? We'll let you continue on, and then because that sounds like we can hear you a little bit better.
Okay. All right. Great. So I think I had talked about my experience. I was also wanting to bring my expertise and my insight. I think I could bring a lot to the table, and I think it's important for nursing to have some input. And like I said, this is very different for me, and so I'm trying to grow myself a little bit more as well. I'm married, have been for 27 years. I have 3 kids. My boy-girl twins are 23, and my son is actually stationed in South Korea. He's a second lieutenant in the Army, so we're very proud of him. And my daughter is also in the healthcare field. And then I have a 19-year-old who is working full-time. So we've been I grew up here in Nebraska, so Nebraska grown. But I think that's about it.
Okay. Yeah, it sounds like you said 25 years of nursing experience, a lot of like ICU, emergency department, radiology. So you definitely got a lot of experience in that realm, it looks like.
Correct.
Yeah. And so you're in are you in kind of near Bennington area? You're 175th and Adams, right?
Actually, I moved last April, so now I live out in Louisville.
Oh, gotcha. Okay. All right. Okay. So what I'll do is I'll look around and see if anybody has any questions from the committee first. Okay.
Sure.
Okay. Are there any questions from the committee? Okay. So far, it doesn't look like any questions. So what we'll end up doing, and I appreciate you filling us in. Like, in your resume looks pretty extensive, and you explain things well in there. And right now you're with Ortho Nebraska, correct?
Correct.
Okay. All right. Okay. All right. So what we'll end up doing here, the next step for us as a committee is we'll have an executive session, and we'll discuss your candidacy for the appointment, and then we'll end up voting on it. And if it goes through committee, then it'll get on the floor for a debate and a vote, and then it'll go from there on the governor's desk. So.
Perfect. Thank you.
Yeah. Do you have any questions of us at all?
I do not.
Okay. Excellent.
I'm very excited about this.
All right. Well, good. Okay. Well, we'll move it through, and then you'll hear more once we have the executive session and how it moves through committee. Okay.
Perfect. Thank you so much.
Yes. Thank you very much, Heather. Thanks for the call.
All right. Bye-bye. Have a great day.
Yep. Bye.
Bye.
Okay. That will end the hearing for Heather Cramer for State Board of Health. And now we will move it on to Dr. Jaime Dodge, right? Yep. We'll move it on to him, and we'll open it up for him for State Board of Health. Welcome.
Welcome. All right. Thank you.
Yeah, so same kind of thing. You can just kind of fill us in and let us know all the particulars about why you're running and your experience, and we'll kind of go from there.
Great. Yeah. Thanks. Jaime Dodge. I grew up in Callaway, so Custer County, and I've lived in Nebraska just about all my life since then. So a little stint in Iowa, but I practiced medicine for about 20 years. I graduated Chadron and then the Med Center for med school, and did residency here in Lincoln, and then practiced out in Alliance, then Northwest Iowa, then back to actually Sioux City area to teach family medicine postgraduate. So I was a professor through actually the Med Center, South Dakota, and University of Iowa. And that program was focused a lot on training family doctors to go out in the rural. I mean, a lot of them went urban, but I really had a heart for a state like Nebraska that has a diverse, body of population, but also geographically diverse, to where you'd need doctors that could serve, in Broken Bow or also Lincoln. So I enjoyed practicing in some of the smaller towns in Nebraska in the emergency room, hospital, and then now in one of the largest, so in Lincoln. So I've been back in Lincoln for about 7 years, and the opportunity came to serve on the Board of Health, and I felt like that was a great way to continue to serve the state as a whole. So excited to do that.
Awesome. Okay. So you're in Senator Brewer's district?
Well, so I was, growing up, it was always Senator Jones from Eddyville. So I think 39. I'm saying that right. But right now I'm in Lincoln. So right now I'm in
Gotcha.
Senator Geist's.
Gotcha. Okay.
Yeah,
All
I
right.
live in Lincoln, practice here.
Okay. It looks like
Yeah.
you have some extensive service in the military.
Yeah, spent 12 years in the Army National Guard.
Okay.
And a couple of deployments to Afghanistan and Iraq. So
That was
Yeah.
medical, combat medical
I
experience.
was a medical officer. So yeah, I mean, it was interesting because my background training and then practicing in rural Nebraska, I felt prepared me pretty well for, the combat zone because again, you're the only doctor in the middle of wherever, Fox Butte County or Afghanistan. So I basically functioned as an emergency room doctor in the combat zones.
Okay.
Mhm.
Awesome. So are there any questions from the committee? Make sure. Well, it doesn't look like it. You filled us in pretty good. And, it looks like you laid everything out here pretty good too in your resume and all of your experience. And I think it'd be, the State Board of Health would be in good hands to have you on there. So again, just like I mentioned before, we'll end up kind of discussing it in executive committee. We'll vote on it as a committee, and then whatever happens there, if we vote out of committee, we don't get on the floor for further discussion and a vote, and then get on the governor's desk for him to sign. So
Great.
all right.
All right.
Well, good. Excellent. Well, thanks for coming. Appreciate
Thank
it.
you very much.
All right. Well, good. Well, that'll conclude our hearing for Dr. Jaime Dodge, and we will take a break until 1:30. Where we will start with LB 677. All right, well, good afternoon and welcome to the Health and Human Services Committee. My name is Senator Ben Hansen. I represent the 16th Legislative District in Washington, Burke, Cumming, and parts of Stanton counties, and I serve as chair of the Health and Human Services Committee. I'd like to invite the members of the committee to introduce themselves, starting on my right with Senator Ballard.
Bo Ballard, District 21, Northwest Lincoln and Northern Lancaster County.
Lynn Walls, Legislative District 15, which is Dodge County and Valley.
Ryan Hardin, District 48, Banner, Kimball, Scottsbluff counties.
Michaela Cavanaugh, District 6, West Central Omaha, Douglas County.
Also assisting the committee is our research analyst Bryson Bartels, our committee clerk Christina Campbell, and our committee pages for today are Delaney and Sophia. A few notes about our policy procedures. Please turn off or silence your cell phones. We'll be hearing 3 bills and we'll be taking them in the order listed on the agenda outside the room. On each of the tables near the doors to the hearing room, you will find green testifier sheets. If you're planning to testify today, please fill one out and hand it to Christina or one of the pages when you come to testify. This will help us keep an accurate record of the hearing. If you are not testifying at the microphone but want to go on record as having a position on a bill being heard today, there are white sign-in sheets at each entrance where you may leave your name and other pertinent information. Also, I would note if you are not testifying but have an online position comment to submit, the legislature's policy is that all comments for the record must be received by the committee by noon the day prior to the hearing. Any handouts submitted by testifiers will also be included as part of the record as exhibits. We would ask if you do have any handouts that you please bring 10 copies and give them to the page. We use a light system for testifying. Each testifier will have 5 minutes to testify. When you begin, the light will turn green. When the light turns yellow, that means you have 1 minute left. When the light turns red, it is time to end your testimony, and we will ask you to wrap up your final thoughts. When you come up to testify, please begin by stating your name clearly into the microphone, and then please spell both your first and last name. The hearing on each bill will begin with the introducer's opening statement. After the opening statement, we will hear from supporters of the bill, then from those in opposition, followed by those speaking in a neutral capacity. The introducer of the bill will then be given the opportunity to close the statements if they wish to do so. On a side note, the reading of testimony that is not your own is not allowed unless previously approved, and we do have a strict no prop policy in our committee. With that, we'll begin today's hearing with LB 677 and welcome up Senator Day to open.
Thank you, Chairman Hansen, and good afternoon to my fellow members of the Health and Human Services Committee. My name is Jen Day, that's Jenday, and I represent Legislative District 49 in Sarpy County. I'm here today to introduce LB 677. LB 677 provides funding to remove barriers to employment and education for families receiving assistance through the Temporary Assistance for Needy Families, or TANF. Specifically, it provides $15 million over 5 years to no more than 2 nonprofits that provide services to TANF families in each of the following: a public school, a private school, and a homeless shelter. The nonprofits shall provide the following services: youth development, adult education, mental and behavioral health, access to weekend food, basic needs support, and job training for youth. This bill does not use general fund dollars or even state dollars. Instead, it taps unused federal dollars under temporary assistance to needy families. TANF is a federal program in the United States that provides financial assistance to low-income families with children. The program was created in 1996 to replace the Aid to Families with Dependent Children, AFDC, program. TANF provides assistance to families for a limited period of time, generally up to 5 years, and is designed to help families achieve self-sufficiency. States are required to impose work requirements on TANF recipients, which generally require adults to participate in work-related activities to receive assistance. States may also impose time limits on TANF assistance and may reduce or terminate benefits for families who do not comply with program requirements. Each state has considerable discretion in how they use TANF funds to support workforce development, but there are several common strategies that states use. One common approach is to provide education and training programs that help TANF recipients develop the skills and knowledge they need to succeed in the workforce. This can include basic education, literacy classes, and assistance meeting basic needs. In addition, TANF funds may be used to support other types of workforce development activities, such as behavioral health services, job search assistance, transportation assistance, and childcare services. Behavioral health can encompass a wide range of services aimed at improving mental health and emotional well-being, including mental health counseling. TANF funds can be used to provide individual or group therapy services to low-income individuals and families. This can include counseling for depression, anxiety, trauma, and other mental health concerns. It can also include parenting classes. TANF funds can be used to support parenting classes that provide education and skills training to low-income parents. This can include classes on child development, discipline, and communication. And lastly, it can include support groups. TANF funds can be used to support groups for individuals and families who are experiencing mental health or substance abuse issues. This can include peer support groups or groups led by trained professionals. To access TANF funds for workforce development, states must submit plans outlining how they will use the funds to help TANF recipients move towards self-sufficiency. These plans are subject to federal review and approval. One nonprofit that works in this area is Completely Kids. Their adult education programming helps parents build the skills they need to obtain employment and higher paying jobs. Their mental and behavioral health programs for kids and adults help develop the skills necessary to be successful in the classroom and eventually the workforce. Additionally, their weekend food program meets basic needs so that parents and their children can focus on learning and improving their situation rather than identifying where their next meal is coming from. This combination of services addresses several critical barriers to employment that families living in poverty often face. Before I conclude, I did want to mention that we're open to making some cleanup changes to the bill, and specifically, we are working on an amendment to strike the metropolitan class designation. Overall, TANF is intended to provide temporary assistance to families in need while promoting work, responsibility, and self-sufficiency. I believe this bill will help families to obtain these goals. And with that, I'm happy to answer any questions.
Thank you for that opening. Are there any questions from the committee? Senator Eby.
Thank you, Senator Hanson. I couldn't help but detect that someplace you said in here that part of the program helps you with basic needs. And then I think you also said with weekend food programs,
Yes,
is that how the funds can be used?
correct.
And in my notes that I have, at least it says, mine says creates. Is this a new program?
This is a new grant program, yes.
Okay, so
But
it's a new program to Nebraska, is that, am I right?
correct.
Oh, okay.
But Completely Kids isn't already existing.
The other question I had, Mr. Chairman, if I might, is also in my notes, it says the grants would be managed, if you will, by two not-for-profit organizations or nonprofits, I guess.
Correct.
How are those selected?
I'm not entirely clear on how they're selected. Maybe somebody behind me would be able to answer that question.
Okay, thank you. Thank you, Mr. Chairman.
Yes. Any other questions from the committee? All right. Seeing none,
Thank you.
Yep. We will take our first testifier in support of LB 677. Is there anybody wishing to testify in support of LB 677? There we go. All right. Welcome.
Thank you. Good afternoon, Chairman Hanson and members of the Health and Human Services Committee. My name is Rasna Sethi. That's Rasna Sethi, and I'm the policy analyst with Open Sky Policy Institute. I'm here today to testify in support of LB 677 because it would spend down the Nebraska's TANF rainy day fund. The Nebraska Department of Health and Human Services has kept a significant reserve in the Temporary Assistance for Needy Families Rainy Day Fund, also known as the cash reserve. It has grown by 64% over the past decade and now sits at $130 million. While the fund has grown, funding for services supported by the TANF block grant have not seen an increase in funding. Instead, there has been a dramatic reduction in benefits under the ADC program, which provides cash support for low-paid families, as well as other support programs. There are fewer people receiving ADC, not because there's less need, but because there are stringent requirements to apply and high rejection rates. Nebraska is one of several states that decline nearly 90% of applications. Nebraska is therefore one of the states most likely to fail to spend its entire block grant, which isn't an efficient use of taxpayer dollars. To have the rainy day fund be double the amount of the annual block grant which is about $56 million. While there is an increased need for support to programs and recipients keeps those funds sitting in an account while there could be flowing through local economies and helping families support their basic needs. We also support removing barriers to employment and furthering education to TANF recipients in impoverished areas. Some of the biggest barriers to economic self-sufficiency are finding stable employment and low education attainment. Other barriers include complicated administrative procedures involved in applying for federal benefit programs and the unsustainability of these benefit programs. Having a conduit organization that provides additional support could open the gates to new opportunities for TANF recipients. For these reasons, we support LB 677 and urge the committee to vote it through. Thank you. I'm happy to answer any questions.
Thank you. Any questions? I have one.
Sure.
We mentioned a moment ago, or the question was asked by Senator Reapy in terms of the two organizations. So would they essentially be the main interface in terms of how people actually connect with the opportunity to get, so would it be those two?
I believe so.
organizations?
I believe the way the bill is written, the department would allocate these funds to the organizations, and then the organizations would then carry out the services
Okay.
using those funds.
Okay. Practically speaking, whomever the organizations turn out to be, how do people find them? I guess, how does the communication process get out to the community?
That's a good question. And to be honest, in my previous experience, although it hasn't been in the state of Nebraska, I come from New Jersey actually. And I did work with the TANF administration in New Jersey, and we worked with conduit organizations and provided outreach via applications and programs, and particularly with the workforce requirement, organizations are contracted with the department to provide those services. So they're sent there through referral.
So the department kind of vets them on how they best plan to communicate that information to the public.
Well, yes, to the public, but as it would be through referral that TANF recipients receive these services.
Gotcha. Thank you.
You're welcome.
Any other questions? Senator Valley.
Thank you, Mr. Vice Chair. Thank you for being here.
Yeah.
Does Open Sky keep any metrics on TANF recipients if it's working? I don't know.
To be honest, I think those statistics would come from the Department of Health and Human Services. And in my knowledge, although I haven't been in this position for very long, they're not forthcoming with data. So I don't know that there is demographic specific data. We would welcome it. And also, I do believe there is utilization data out there as to how ADC benefits are utilized.
Okay, thank you.
You're welcome.
If I can, just thought of another one, and we sometimes ask this question on lots of different topics, but do you know if the CDC gets that information such that at a national level they can interface with that kind of thing? Or
Another very good question. I believe that it would be ACF that would receive this data. I forget what ACF stands for, but they're the federal organization that oversees TANF. But I believe they are required, the Department of Health and Human Services is required to report program participation data. And there are metrics that they have to reach in order to qualify to receive annual block grants. Like I believe it's about, for the workforce participation program, for single parents, it has to be a rate of 50% that are participating in workforce development programs in order to keep receiving the block grant program. So there are requirements that they have to meet and metrics they have to reach.
okay, very good. Thank you.
You're welcome.
The next testifier in support of LB 677. Welcome.
Good afternoon. My name is Carla O'Donnell Rizzo. That's C-A-R-L-A, O'Donnell, O''D-O''N-N-E-L-L -R-I-Z-Z-O. Don't hyphenate if you already have an apostrophe. Just Side note for you all. I'm the Chief Executive Officer at Completely Kids. You're being handed a copy of my written testimony, but that can be for your reference. I'd much rather do this as more of a conversation and me explaining a little bit about who Completely Kids is and why I think, why I know Completely Kids can really help not only our current families, but extended families to be able to overcome barriers they're experiencing. The vast majority of the families that we serve at Completely Kids live in poverty. We're concentrated mostly in South Omaha, a little bit in North Omaha, at 16 locations, including our building on 26th and St. Mary's Avenue. So the hub, if you will, of what we do really centers around children. So Completely Kids kind of says that in after-school programming. And some of you are familiar with what after-school programming looks like and how that can happen. But what makes Completely Kids a little bit different is the support that wraps around that. So in addition to high quality after school programming, we provide mental and behavioral health services to our kids. That starts at the very basic level with just really helping kids to put a language behind emotions and how they're feeling and really set them up for success. We have seen incredible increases in those needs. I know you've all heard about that, so I won't waste my time on that right now, but since COVID. So that's where it starts. And then we move up to group work and then individual services. And in the last year, we've also extended that to some of our parents. As our parents see the benefits that their children are experiencing as they're addressing mental and behavioral health needs, some of them for the very first times in their lives are saying, wow, that's incredible. I see the progress. I want some of that too. So that's another key piece of what we do. Weekend food has also had a substantial increase in the last year. About a year ago, we were serving 550 kids a week with a bag of food to take home on the weekend. It's reasonably healthy, meets some nutritional needs and make that they've got something. We're now at 860 because, of course, we all know what's happening with that. So that's another piece of it. The next piece is a teen program. So that's a workforce development specifically for teens. Those are our juniors and seniors in high school. They interview with us. They get jobs in our after school program. They're paid. So they are gaining something to put on their resume, learning some of those very basic skills to be able to be successful in the workforce. And then every other week we'll say they have a break from the after school program and they have seminars where people come in and we're working on interview skills and how to write their resume and career exploration and really getting them ready for their next step, whether that's college or a trade or whatever it might be for them. The last piece is really what applies very directly to this, and that's the parent programming. So last year, about 300 parents went through this at our building on 26th and St. Mary's Avenue. We have space set aside with parent education classes. So that's GED, that's ESL, that's computer basics. It's really, we ask our parents often, what do you need to achieve your goals? How do we help you make your family more self-sufficient? And they tell us what that means. And sometimes it's, adding another GED class on a Saturday, or we have things that happen during the day, in the after school hours, and on Saturdays, because not everybody works a 9 to 5, Monday through Friday. So when can parents access that? And what's really special is because of the long history that we have and the relationships we have with all of these families, the trust is there. So families will come in and access those services with us. So while there are other places that do a lot of these different pieces, and that's wonderful, we use a lot of them as partners, we make it easier for people to come in and say, yes, I'm ready for this, because we already have that pre-existing relationship and the trust built with them. So I think that's pretty special. Across all our services, we've seen at least a 20% increase in service utilization in just the last year. We reopened our building in 2019, just before COVID hit, and expanded our current footprint in that area so that we could have more, we could have kids there while the parents are there, so that there's no childcare barrier to accessing any of those classes and services. There's a place for your kids to be while you're learning. Some of you might be working parents, and I think we can agree that it's very difficult to find time for yourself to learn something, to do a skill, when you're also trying to balance all of the childcare. And so by removing that barrier, again, we have more success in getting parents to come and come utilize our services. So I've got just a little bit of time left. I'm open for any questions that you might have.
Thank you.
You're welcome. My pleasure.
Any questions?
Thank you. Thanks for coming today.
My pleasure.
I don't know if you have any offhand, but are there any success stories that you could share with us? Just briefly.
I do. So you might actually have some written testimony on some of these. I had two parents that were very excited to submit something online. They were working, so they weren't able to be here. But I was actually at the Omaha Chamber of Commerce about a month ago giving a presentation. And at the very end, one of these parents raised their hand and she said, "You might not remember me, but I got my GED at Completely Kids. And now I'm working at," that one was at the Heartland Workers Center. And another one raised her hand on the other side of the room and said, "You might not remember me, but I took ESL classes with you and now I work for the Omaha Chamber." So just randomly people in the community, and I've been there for 24 years. And so I know a lot of these families and their kids over time. And it's just really incredible to see the impact in the community, but it's really there.
Does the Omaha Chamber, they're supportive of the program, or were you there just to?
I was there just giving a presentation on resources and opportunities that are working with immigrant families, but we have a great partnership with them. They utilize our space because it's gorgeous. Anyone happens to be in the area, come take a tour. It's really incredible.
Nice. Very good. Thank you.
You're welcome.
Any other questions? Senator Ballard.
Thank you, Mr. Vice Chairman. Thank you for being here today.
My pleasure.
Can you expand a little more on your workforce training component
For the adults.
for the juniors and seniors?
The juniors, that's my favorite. I helped create that program. So these are juniors and seniors in high school. Most of them were with us when they were little kids. So what we did was we created an opportunity for them to get their first job. So they have to do all the things you have to do to get a job, do the resume, have the interview skills, and then they're placed in an after-school location. So they're kind of an assistant to that. So they help with planning, they help with doing program things, and they have to show up on time. All those basic job skills that just people don't have sometimes. We make sure they have those and develop them. And then every other Friday they come to our main facility and they have like a seminar. So whatever, here's how you fill out the FAFSA if you want to go to college, to make sure that they understand what they need for that and make sure they're ready for whatever that next opportunity is. And then selfishly, when they graduate from high school, a whole lot of them stay and work with us and become what we call program support staff. So from junior to program, it's a workforce pipeline.
Because that was my next question. What's the next step after your program? Do you have statistics on, do they go on to a 2-year, 4-year, or do they enter the workforce?
Most of our kids end up going to 2-year or 4-year. I can get you those exact statistics.
Just
but
curious.
It's been really successful. A lot of them stay and work for us. We have, my clinical director actually was one of our kids. So we really like to help people, find out what their goals are. And that's part of what they do. And she wasn't in that program, but find out what people's goals are and then help them to get there, whatever that means for them. So
Perfect. Thank you.
Welcome.
Very good. Any other questions? Seeing none, thank you.
Thank you.
Any other supporters of LB 677? Welcome.
Thank you. Good afternoon. My name is Megan Addison, Megan, Addison, Addison, and I am the Executive Director for Collective for Youth, which is a nonprofit located in Omaha, Nebraska. We are a collective impact organization that's tasked with providing high quality after school programs, primarily only in Omaha Public Schools, but we also provide support through fundraising and training to our nonprofit partners. We currently hold an agreement with Omaha Public Schools to provide after school programs in 42 of their school buildings, majority of them elementary to our high school, 9 or middle. Through this contract, we contract with local nonprofits like Completely Kids, who we're talking about today, and they provide those services directly in the after-school space. We've been doing this work for more than 15 years in Omaha and have partnered with Completely Kids for those full 15 years. So I'm here today in support of the LB 677. Even though through our work at Collective for Youth, we financially support Completely Kids for the after-school youth development component, we know that it's so important that there's a holistic approach with working with families, and that's part of their mission, which makes them unique to other nonprofits that are in the youth service field in Omaha. Across our sites that we work with, we're seeing more mental health, behavioral needs for students. We also are seeing that families are, they are experiencing trauma that also stems from living in poverty. So providing those holistic services through education and removing those barriers is key for families to be successful. And we do our part by keeping kids safe after school and educated during that youth development space. In the school buildings that we work with, majority of the students are on free reduced lunch, 70% or higher, and they are in the most needed areas in Omaha, and that's also the same footprint that Completely Kids have. About 90% of the families are eligible of the sites that Completely Kids works with, and through their expanded support, those are the resources that families need to keep working and to keep their kids engaged in school, which is critical services that they provide every day to those students. Just in closing, you know, my background is social work. So I got into this work for prevention and services that we can provide to kids and families to keep them connected to their community, to their school, and help families continue to work are critical so that we can continue to develop the important workforce that we need in Nebraska. So with that, I would answer any questions you might have.
Thank you. Any questions?
Sorry. And I know that this was probably already talked about, and I may have missed it. How many kids, do you know how many kids you're serving through this program?
So in Collective for Youth overall, in the 42 sites, we average about 4,000 students a year with, you know, some sites serving 75 kids a day, some 50. It just kind of varies based on the school population. And then Completely Kids is actually in 10 of those 42 buildings. So they're serving a, you know, a large component of those students every day.
Thank you.
Very good. Any other questions? Seeing none. Thank you.
Welcome. Thank you.
Any other supporters of LB 677? Going once, going twice, 2.5. Any in opposition to LB 677? This is your one chance to be oppositional. Seeing none, anyone in the neutral for LB 677? Well, this would close LB 677. We did have some letters, 5 proponents, 2 opponents. And I believe Senator Day has waived in advance. So that would close LB 677. We will wait just a few minutes for Senator Conrad. We're in that fun time of year, folks, where all of us take turns introducing multiple bills in multiple rooms, and sometimes we have to dematerialize and rematerialize in multiple places at one time. So it's crazy. So we'll wait just a couple minutes and see if Senator Conrad can join us soon. In the meantime, Senator Ballard, would you stand and sing us a song?
So, about 15 years. I never heard of this song.
I'll think the mics are still hot. I don't know if you want that.
Maybe I didn't.
They're on over on St. Mary's. You know what's children's museum is.
Oh, this
They're
is-
just like a couple months.
used to be a Ford dealership.
The children's museum.
This one down.
Yeah.
There she is.
Ford dealer.
Hello, friends.
Well,
afternoon.
welcome to the finest committee. No offense to any that you serve on. Senator Conrad, do you have LB 333 to share with us today?
I do. Thank you so much. Good afternoon, Vice Chair Harden, members of the committee. My name is Danielle Conrad. It's Janielle Conrad, Conrad. I'm here today representing North Lincoln's Fightin' 46 Legislative District, and I'm proud to introduce LB 333. So let me just give you a quick overview about how I got interested in this issue, and then I can give you a few of the top lines on the specific policy details contained in the legislation today. So back right out of law school, I worked as a public interest attorney on behalf of low-income families and new immigrants at the Nebraska Appleseed Center for Law and the Public Interest. As part of that work, I helped to develop their public policy program that you frequently interact with in the halls of power working on policy advocacy for a lot of those same constituencies and on a lot of important issues. During the course of that work, there was an effort that was convened. I'm sure esteemed fiscal and research analysts may remember this over the years, to pull together a variety of different stakeholders to really do a hard look at our Medicaid program in Nebraska and figure out what we could do to ensure that it was meeting its policy goals and to address what at that time were really significant concerns across the political spectrum about the ballooning costs in that program, to try and figure out how we can advance the policy goals and get a better kind of handle on the budgetary impact for the state of Nebraska. So as part of that effort, with groups like AARP, representatives for kids groups, I think the Catholic Conference was a part of that, Lutheran Family Services, poverty advocates, healthcare advocates. It was a very, very broad and diverse group of stakeholders that came together to look at these issues. And I had the pleasure and the opportunity to be a part of that as a baby lawyer, and it was very important and interesting learning opportunity. So as part of those discussions, one thing that group identified to try and get a better handle on meeting the policy goals in Medicaid, but also finding state budgetary savings, was looking at some of the options available under federal law to expand family planning services. In many of our sister states, in both deep blue and deep red states over the years, have embraced either waivers or Medicaid plan amendments to expand family planning services to more of their consumers and citizens. Now, on that point, we were not able to find full consensus of the working group for a variety of political reasons. But that's how this issue first showed up on my radar screen, and it has intrigued me ever since. So I've brought similar measures in the past during my previous term of service. I believe Senator Keneally, Senator Wishart, and other senators have continued to look at these options as well. So this is definitely not a new issue for the Nebraska Legislature, but I think that it's always a good time to revisit sound policy, and particularly as we're grappling with some really complex issues in the realm of reproductive health. I think it's really important that we examine very closely our state's approach to ensuring that we have family planning services available for Nebraskans, which help to reduce unintended pregnancies. So with that, LB 333 would require the Department of Health and Human Services to submit the state plan amendment by October 1st, 2023 for coverage of family planning services under the Medical Assistance Act. This bill's introduced many times, as I said. And one thing that I would note that is a little bit different in this version versus what you've seen in past years is the fiscal note. And I went back and I did kind of a look and a comparison of fiscal notes of years gone by, and the fiscal note that you have before you today looks very different than the fiscal notes that we've seen in previous years, which demonstrated a much lower price tag and a much more significant cost savings for the state of Nebraska. And that also incorporated and took into account the multiplier effect that comes with expending resources on family planning services. So I will continue to work with the fiscal office, this committee, and other stakeholders to try and perhaps update that fiscal note and that methodology moving forward. But in addition to being good policy, it was always an exciting opportunity to put this measure forward as well, because it resulted in cost savings. So with that, I'm happy to answer questions. I'm also happy to turn it over to the folks behind me today.
Thank you. Any questions? Senator Reapy.
Thank you, Senator. Thank you
Hi.
for being here. Can you tell me a little bit? This is a piece of legislation that's been pat a lot of times.
You're right. You've probably seen it before, Senator Reapy.
And I
Yes.
know if it came up when Speaker Scheer was here, if it had any fiscal note, it went fizzle.
Mm-hmm.
So I don't know. Was there something that was repeated year after year, or was it a philosophical thing about, as I would view it, probably expanded Medicaid?
Yeah, that's a good question, Senator Reapy, and perhaps we'll have a chance to revisit some of the arguments on both sides of the coin here today. But My understanding is that generally the opposition has really come kind of in from two threads. One being fiscal in nature, that any sort of, additional expansion of Medicaid would be a burden on taxpayers and that already large budgetary expenditure. The other, I think, would be perhaps political and moral in terms of a further expansion of family planning services and contraceptive services, which doesn't align with the deeply held, sincerely held religious values of some stakeholders.
Is this, I'm trying to relate how it would, Planned Parenthood, to me, when I read it, it sounded like it was almost a government kind of Medicaid-sponsored Planned Parenthood. And I'm trying to figure out, is that duplication or is it competition or what?
Yeah.
Is there a relationship even?
Yeah, thank you for the question, Senator. So let me take a step back for a minute. So we already offer family planning services in our Medicaid program. It's always been a part of that kind of essential packages of services that we have for folks that qualify otherwise because of their income or for another reason. What this measure does, and similar measures have done in the past, is that it increases that eligibility for this specific set of services for more Nebraskans. So maybe you wouldn't be able to qualify for full Medicaid, so to speak, because of your income, because you make a little bit too much. But by expanding the eligibility for specifically for family planning services, which we already provide in the Medicaid program, this just helps more Nebraskans access those services. And on the Planned Parenthood question, Senator, and thank you for bringing that forward. Absolutely. Family planning services have always been a part of the work that Planned Parenthood has provided to our communities across the state. We also receive family planning services from a host of medical providers, whether that's your local doctor or one of the family planning clinics that we have in our family planning network across the state. And the thing that's important to remember about family planning services is that these can mean different things to different people for different reasons, right? And the Medicaid program in particular recognizes people's deeply held, authentically held religious beliefs to pursue the family planning services that are right for them. So that might include things like counseling, in addition to contraceptives. So that's one thing that I really like about the policy design in general, is that it is not a one-size-fits-all approach, but lets people honor the best needs for them, their faith, and their family.
Is eligibility based on federal poverty line?
Yes, that's right.
And that's usually a percentage. What is it currently and what is this proposed?
That is a great question, Senator, and maybe it helps us out a little bit in the fiscal note, but I can triple check my notes and dig through that and come back on closing, because I think I just don't have it off the top of my head. Currently serves folks, I'm looking at the fiscal note, at 225% of the federal poverty level, and I think this moves it up a little bit, but I will get you a more cogent answer on that closing, so I'm not fumbling around on the mic. Yes.
Okay, thank you very much.
Yes, thank you so much.
Any other questions, Senator Cavanaugh?
Yes.
Thank you, Senator Conrad, for
Thank
being
you.
here and for bringing this bill. I'm just looking at our sort of committee synopsis of some of the related services, which you probably don't have, but well, you have it in a different version. But so the services provided here, are they not currently covered, like HPV screenings? Is that something that's currently covered under Medicaid, or is that not?
So my understanding, Senator Cavanaugh, and happy to be corrected about this by folks that might be coming behind us, is that I don't believe that the intent of this legislation is to provide coverage for anything new or different than Medicaid is already doing in Nebraska. But my intent is just to ensure that we move up the eligibility for those family planning services. And if I got it wrong, I'm happy, again, to correct the record.
So
but
it's the current services for around family planning, expanding the eligibility for family planning services.
You got it.
It takes me a while. But
Join the club.
Sometimes I get there. Thank you so much.
Any other questions?
Okay, thank you.
Seeing none, will you be around to
I will.
close?
I will.
Well, thank you.
It's hard to pull myself away from this esteemed committee.
This is, yeah, and I understand. I understand.
This is killing me.
Supporters for LB 333. Welcome back.
Oh, thank you.
We have
Glad
not
to-
adjusted the chair. I am sorry.
You know, I filed the requisite government form. I know
Thank
it's gonna take a while. We'll
Thank
check
you.
the fiscal note,
We-
maybe
we-
next
We
session.
appreciate your patience with us.
It's okay. I got taller, so it's okay. It's worked out great for everyone. Vice Chair Harden, members of the Health and Human Services Committee, my name is Erin Feichtinger, ErinFeichtinger, and I'm the Policy Director for the Women's Fund of Omaha. At the Women's Fund, we believe that all Nebraskans deserve the right to decide if, when, and how to start a family and have access to the necessary health care when doing so. As such, we fully support LB 333 and its efforts to include to expand eligibility to family planning services under Medicaid and Medicare plans. For many low-income individuals, Medicaid is a critical resource to receiving appropriate and comprehensive health care. It is imperative that family planning services are expanded under Medicaid to ensure that Nebraska women are provided the care they need, whether it is treatment for STIs, cancer prevention, that shouldn't say vaccines because we don't have a vaccine for cancer yet. My apologies for the typo. Cancer prevention screenings, or screening for domestic violence. Community-based organizations have long been the providers of STI testing for communities of color, LGBTQ individuals, and those with lower socioeconomic status who would qualify for Medicaid. But federal funding for these programs has decreased by nearly 40% since 2003. Congenital syphilis, which if left undiagnosed and untreated during pregnancy, can lead to miscarriages, stillbirths, and severe birth defects. Congenital syphilis increased more than 150% between 2013 and 2017, and another 40% between 2017 and 2018. Providing coverage of screening for intimate partner violence is also critical. The most severe outcome of intimate partner violence, homicide by an intimate partner, is heightened around the time of pregnancy and childbirth. Approximately 60% of homicides that occur around the time of pregnancy are related to intimate partner violence. Experiencing IPV during pregnancy is associated with higher rates of preterm birth, lower birth rates, and lower rates of breastfeeding. 13% of Nebraska women aged 18 and older are in poverty. Women in our state still make less than men at 78 cents for every dollar a man is paid. Providing family planning services under Medicaid will have significant and long-lasting positive impacts on Nebraska women's educational attainment, career advancement, and general economic stability. When women can decide if and when to start their family, they can stay in school or longer in the workforce, they can earn higher wages and plan for leave if they do decide to have a child. Expanding Medicaid and Medicare coverage to include family planning services will allow more Nebraska women to take care of their reproductive health, improve their short and long-term health, help those experiencing domestic violence, and help build their economic security. So we would strongly urge this committee to support LB 333, and I am happy to answer any questions to the best of my ability.
Thank you. Questions? Yes, Senator Reed.
Thank you, Chairman. I'm looking at your letter. I'm looking at, I guess, the second paragraph. Down at the bottom lines in there, it talks about increases of more than 150%, 2013 to 2017. You see where I'm at on that?
Yep.
And another 40. I'm always leery about percentages without seeing absolute numbers too, because, you know, if you have two or one increases,
Sure.
you know, it's just, so I'd like to see, can you help me out with that? I mean, is that?
Yeah, I have a
Pretty well.
citation in there, and I am more than happy to follow to do that for you and go in and get those real numbers for you. And those numbers are nationally.
Okay.
I will
Yeah,
definitely.
just a thought, would it save us both time, just, I mean, it's 50,000, they go from, you know, 50,000 to 75.
I just wouldn't feel confident in my answer.
Okay.
And
That's
everyone
'cause
loves
you
a
have a
good
PhD,
email,
you
so
know.
I will follow up with you after.
Okay,
Yeah, and thank you for the question.
Any other questions? Senator Cavanaugh.
Thank you. And in all fairness, you probably don't know this, or maybe you do know it because you're a genius, but
I contain multitudes, Senator Cavanaugh. Let's see how it goes.
Dr. Feichinger. Medicaid currently doesn't cover fertility, does it? So
I would definitely not know the answer to that
Yeah.
question.
that's something that was sort of what I was intrigued by with this bill, and I don't think that it does. And just want to put that out into the ether that low-income people who are planning when now to get pregnant also have fertility struggles. So maybe someday. Thank you, Dr. Feichinger.
Any other questions? Seeing none, thank you.
Thank you.
Senator Ballard and Senator Walls have been charged with fixing the chair before you come back next time. So, any other supporters of LB 333?
Senator Hardin and members of the Health and Human Services Committee, my name is Sarah Marish, Sarah Maresh, and I'm the Healthcare Access Program Director at Nebraska Appleseed, testifying in support of LB 333 on behalf of Appleseed. One of our core priorities is working to ensure that all Nebraskans have access to quality, affordable health care. LB 333 would require the state to submit a state plan amendment to provide family planning services to individuals up to 194% of the federal poverty level. And so just to think about this more broadly, really what this bill does is create a new eligibility group for people up to 194% of the federal poverty level to cover family planning services. So it explains it a bit more in the fiscal note, but the target group that we're really looking for and covering in this bill is folks that are exceeding Medicaid expansion income, and then folks who would not fall into like the pregnancy category. So that's the really target group we're thinking of here in this bill when you look at it. Over half of the states, including Montana and Texas, have taken up the option to cover this eligibility group and draw down significant federal funding. Because this bill would allow more individuals to access critical family planning services and could even produce long-term savings to the state, Appleseed supports this bill. Access to family planning services can improve outcomes, reduce their costs. LB 333 would increase access to services to reduce unintended pregnancies. This bill would support families by giving them access to services they need to make the choices that are best for themselves and their health, which has positive impacts on their social aspects, economic aspects, and physical health and mental health aspects of their lives. Additionally, this bill could also result in cost savings to the state. First, the federal government pays a majority of the cost for the family planning services that are contemplated in this bill. Second, data demonstrates that family planning services can lead to overall cost savings. In fact, for every public dollar spent on pregnancy prevention, a little over $4 was shown to be saved on maternity and infant care among Medicaid-eligible women whose unintended pregnancies were prevented. For these reasons, we respectfully request that the committee advance LB 333. Thank you, and I'm happy to take any questions.
Thank you. Any questions from the committee? Seeing none, you did a stellar job and left them speechless. Thank you.
Thank you.
Any others in support of LB 333?
Good afternoon. Thank you so much. My name is Andy Curry Grubb. It's ANDICURRY-GRUBB. I'm the State Executive Director for Planned Parenthood, North Central States in Nebraska. Central to our mission at Planned Parenthood is the conviction that all people deserve to live in communities where sexual and reproductive rights are recognized for what they are, which is basic human rights. We strongly believe that every person should have the opportunity to lead a healthy and meaningful life, regardless of their income level or socioeconomic status. We strongly support LB 333 for these reasons. LB 333 expands Medicaid coverage for family planning services, which include all FDA-approved family planning methods, insertion and removal of contraceptive devices, screening and treatment of pre-invasive cancer and breast cancer, cancer prevention, vaccinations, interpersonal violence screening and prevention, and follow-up appointments and counseling for qualifying Nebraskans. All of these services are vital, and some can even be life-saving. Let's start with greater access to a variety of cancer prevention, detection, and treatment services, such as the HPV vaccine, well woman exams, and pap smears. Importantly, this bill also expands eligibility for family planning related services, which includes treatment for invasive cancers. This is critical to ensure that a patient does not receive a diagnosis without the ability to then seek the necessary treatment. We know that with early detection, the 5-year survival rate for cervical cancer is 92%. This fact alone highlights the absolute necessity of creating even easier and affordable access to these services. Next, let's talk about expanding access to one of the most common family planning services, contraception. There are decades of research on the many positive impacts to our society that came from the advent and broad availability to birth control pills. I've included a link here to review a review of this evidence, but will quickly mention that they include increased educational attainment, higher workforce participation, higher earnings, and a decrease in poverty. And in the almost 60 years since the birth control pill was made broadly legal in our country, the options for how to delay and prevent pregnancy have expanded. Today, there are 18 options approved by the FDA. I actually used to teach classes on this topic, and folks were regularly amazed at how many options there were. Planned Parenthood is often considered what is called a safety net provider of healthcare. We are one of many across the state who provide healthcare to patients regardless of insurance status or ability to pay. We have a sliding fee scale, and we have various programs that folks can access to help cover the cost of their services. This is important because the cost of contraception can vary greatly, from $42 for a pack of birth control pills to over $1,000 for an IUD. At Planned Parenthood, we conduct in-depth contraceptive counseling to ensure every patient can receive the contraceptive option of their choice based on their health, lifestyle, and general preferences, regardless of cost. And even after working with patients to provide discounts and qualify them for programs that can help, there are still times that patients have to choose an option based on cost that is not their first choice. If LB 333 was passed, this barrier would be all but eliminated for our highest need patients. Not only is this bill good policy, but it's also fiscally responsible. I'll let you read that. Sarah mentioned some of those things as well. My numbers are slightly different from hers, but they're generally similar in terms of the cost savings. Ultimately, this bill empowers Nebraskans by allowing them to control if and when they become pregnant. It also helps continue the positive societal impacts and fiscal savings that we have seen realized when healthcare access is expanded. All Nebraskans, regardless of income, should have control over their own bodies and futures. Thank you, Senator Conrad, for introducing this bill. We urge the committee to advance LB 333 and support the health and well-being of Nebraskans.
Thank you.
Thank you.
Questions from the committee? Senator Cavanaugh.
Thank you. Thanks for being here.
Absolutely.
You're probably the better person to ask the question that I previously asked. Are you aware of if Medicaid covers fertility?
It does not.
Okay. But do you know if it is a possibility for it to cover fertility treatments?
I don't know the details of kind of, I know that's something that's been being asked for at the federal level and kind of included in those discussions for a long time. I don't know where they sit currently.
Thank you.
But I know Planned Parenthood fully supports that all forms of sexual and reproductive health care, including fertility, should be included in these types of.
I have lots of people very close to me that struggle with fertility, and so economy shouldn't stand in the way. So I appreciate learning a little bit more about that. Thank you.
Absolutely.
Any other questions? Seeing none, thank you.
Thank you.
Anyone else in support of LB 333? Supporters? If there are no other supporters, any opponents to LB 333? Welcome.
Good afternoon. Sorry, I'm a little bit sick this afternoon. My name is Marion Miner, Marion Miner. I'm the Associate Director of Pro-Life and Family Policy at the Nebraska Catholic Conference. I'm here today to express the conference's opposition to LB 333. LB 333, among other things, would expand contraception coverage through Nebraska's Medicaid program. And I do want to actually go ahead and state right away that there are things, of course, that are covered under family planning through the Medicaid program that are good and worthy and that the conference has no opposition to. Everything we've heard about STD and STI testing and treatment, about cancer screening and those types of things, of course, are all well and good. But back to the issue about expanding access to contraception through Medicaid. Medicaid does already provide contraception to persons who fall at or below the federal poverty level. With the expansion of Medicaid expansion in Nebraska, or with the passage of Medicaid expansion in Nebraska, that is expanded, I believe, to 138% of the federal poverty level. And this would expand eligibility to 194% of the federal poverty level in Nebraska. Page 4, lines 13 through 18 of the bill provide in part that the department shall submit a state plan amendment for the purpose of providing medical assistance for family planning services for persons whose income is at or below the income eligibility level set by the state for coverage for pregnant women. In real terms and numbers, that means Medicaid will provide contraceptions to persons who are at or below 194% of the federal poverty level. There's some figures there in terms of what that means in real dollars in my testimony. But there are a few reasons the conference opposes this policy. First, numerous studies from sources across the ideological spectrum illustrate that greater access to contraception does not reduce unintended pregnancies and abortion, but in fact tends to increase both. Second, studies purporting to show that increased contraception availability decreases abortion are largely estimates and projections and are not based on hard data. And third, some studies have concluded that a rise in contraceptive use has been a significant factor in the breakdown of marriage, which comes with a high social cost that falls disproportionately on the poor. Two studies by the Guttmacher Institute, formerly the official research arm of Planned Parenthood, found that 48% of women with unintended pregnancies and more than half of women seeking abortions were using contraception in the month they became pregnant. In addition, numerous studies examining sexual behavior and STD transmission have demonstrated a greater willingness to engage in sexually risky behavior when a person believes the risk has been reduced through the use of contraception. Researchers in Spain examined patterns of contraceptive use and abortion from 97 to 07 and found that a 63% increase in the use of contraceptives during that time coincided with a 108% increase in the rate of elective abortions. In July of 2009, results were published from a 3-year program in the UK conducted at 54 sites, which sought to reduce teenage pregnancy through sex education and advice on access to family planning, beginning at ages 13 to 15. And I quote, "No evidence was found that intervention was effective in delaying heterosexual experience or reducing pregnancies," close quote. In fact, young women who took part in this program were more likely than those in the control group to become pregnant and to have had early heterosexual experience. Finally, a study completed in 2018, which analyzed whether oral contraceptives played a causal role in the rise of non-marital births in the United States during the 20th century, concluded that access to the pill significantly increased both non-marital births and demand for abortion, and that effects are especially concentrated among less educated families and minority women. It's also worth pointing out that LB 333 includes coverage without qualification of all U.S. FDA-approved family planning methods, including the drug or device, insert, or provision of various forms of birth control. I note that provision because many forms of family planning approved by the FDA function not only to prevent pregnancy, but to terminate a very early pregnancy, which has already begun. I go into more detail there. I'm running out of time. In conclusion, I will just state the conference opposes LB 333 because social science has demonstrated convincingly that if the goal is to prevent unintended pregnancy and lower the rate of abortion, expanding contraception programs is ineffective and counterproductive. It increases sexually risky behavior. It increases the unintended out-of-wedlock pregnancy rate, which has devastating effects on the poor. And to finish, it increases the rate of abortions, which has devastating effects on everyone. I will finish there, and I'd be happy to take questions if you have them.
Thank you. Questions? Senator Cavanaugh.
Thank you. Thanks for being here.
Thank you.
Am I misremembering it? Did the Catholic Conference support the ballot initiative 427?
Which one was that?
That was to expand Medicaid.
I don't recall. Tom would be the one to ask about that. I should know that, but I don't off the top of my head.
Okay, it was my understanding that they did. That was the ballot initiative that passed in 2018 to
Mhm.
expand Medicaid to a
Mhm.
larger population.
Sure.
You're not sure if you supported it or not?
I like I said, that's something I should know off the top of my head, but I don't.
Well, you're coming in opposition to expanding Medicaid, so it would be helpful to know if you could get me an answer and get the committee an answer. on
Oh,
that.
sure, I'm happy to do that. But I
Thank
would
you.
just
No,
point
that's
out,
fine. That's all I needed. Thank you.
I would point out
You don't need
that
to point anything else out unless anybody else has a question. That answered my question. Thank you.
Go ahead and finish your thought.
I would point out that what I'm talking about here is a specific type of coverage, which is for family planning services, and a subset of that, which is access to contraception. And that is and covered access to contraception. That is the policy that the conference is opposed to, not to Medicaid expansion in general.
Thank you. Any other questions? Seeing none, thank you.
Thank you very much.
Anyone else in opposition to 333? Anyone in the neutral for LB 333? Not seeing any of those. Senator Conrad, would you be willing to come up?
Very briefly.
Thank you.
Thank you so much, Vice Chair Hardin and members of the committee for your time, attention, and good questions. I just provide a couple of quick points to close things out this afternoon. And I do believe and I appreciate HHS did send my office a heads up that they were going to submit a comment as well. So that should be a part of your record to get their perspective on things. But as I noted in my opening, a lot of different states have embraced either a family planning waiver or state plan amendment. Today, and I just double checked to see where it was at, 28 states have utilized this policy option. And those include states like Alabama, Florida, Georgia, Indiana, Louisiana, North Carolina, Oklahoma, South Carolina, Texas, Wyoming, and others. So I think I raised those specific states because I think that they have a very similar political landscape to ours in Nebraska as something that we could look to for effective models that have worked in quote unquote red states, conservative political landscapes, to find common ground to advance the healthcare for their population and to save state taxpayers money. So if you look at the fiscal note, this proposal would extend eligibility to a group of about 10,000 Nebraskans, men and women. And what the eligibility categories would be Nebraska voters by a vote of citizen initiative decided to expand Medicaid eligibility up to 138%. Our current Medicaid options and programs that serve pregnant women is set at about 194%. So what this measure does would expand from that group of 138 to 194, pegged using those existing program eligibility factors, just the narrow eligibility for family planning services for that group of about 10,000 Nebraskans. Senator Reapy, to your question, and very rough kind of back of the napkin scratch here. So the current Medicaid eligibility expansion, which is at 138 now, due to a vote of the people, for a family of four in Nebraska, that's just shy of about $40,000 for a family of four per year. That's the current eligibility at 138%. So for pregnant people, we currently set eligibility at 194% of federal poverty level. So in Nebraska, for a family of four, that's about $58,000 a year. So if you have a family of four and you make just shy of $60,000, you can get some help with pregnancy services, prenatal care, obstetrics, things like that. So what this would do, it would expand family planning eligibility for those kinds of services up to folks that are at 194% of poverty, which is again about $60,000 for a family of four. The final thing that I want to note, in addition to the proven models that exist across our country that show that this program design works for improving health outcomes and for saving taxpayer dollars, including in very, very deep red states, is that there's a 90-10 match on these program dollars in particular. What that means is that Nebraska would need to put up 10% to draw down 90% from the federal government to cover program costs. Again, because of how proven this program is in advancing citizen health and saving taxpayer dollars. The last piece that I would just note, in addition to the dollars and cents and the political realities, is that, and I know this as a mom, and I know many of you can relate to this as parents as well, is that when you have the ability to decide if, when, and how to start a family and how to space children in your family, it takes a lot of pressure off of families to kind of help manage their budget, to make sure that the pregnancies are as healthy as they can be, to make sure moms stay healthy, that we have healthy pregnancies and we have healthy kids. And a part of that is ensuring that we don't have untested or untreated STIs, for example, which can lead to infertility, and that can impact the ability of people who want to start a family or who want to grow their family. So I really see a lot to like about this policy because it ensures that people have better access to quality health care to support their family, or to grow their family, or to grow their family at the right time for them. It saves taxpayer dollars and it has better health outcomes. So the final piece that I'll leave you with, and I was so pleased to hear this during Governor Pillen's State of the State address earlier this year, where he was very, very clear about his perspective that we shouldn't wrap family planning into the abortion dialogue or discussion, that really we should keep those kinds of lines separate. And I'm asking you to do the same by advancing this measure here. I think that we can have a sincere and robust disagreement when it comes to access to abortion care. That's not what this measure is about. This measure is about advancing health outcomes, reducing unintended pregnancies, and saving taxpayer dollars. I really appreciate your time and consideration. Happy answering questions.
Any other questions, Senator Cavanaugh?
Thank you, Senator Conrad, for being here. I really just wanted to clarify that somebody has reached out to me and said that the Catholic Conference was neutral on the Medicaid expansion. I was just looking for clarity in the consistency of their position, and that the Missouri Catholic Conference actually was an active partner in advocating for Medicaid expansion. So I just wanted to clarify that for the record. That I was looking for clarity, that I got it from the outside, and share it with everyone.
Thank you for putting that on the record. And to be clear, I've always appreciated working with the Catholic Conference and other stakeholders across the year, particularly on policies that improve the lives for the poor and those that are living in poverty. And so I know that they have been very thoughtful about supporting things like the child tax credit that I brought forward this year. We've worked hand in glove on food stamps issues and other issues like that, economic justice issues, anti-poverty issues. I understand that we have a sincerely held, authentically held, different perspective when it comes to family planning and abortion care. And I respect and understand that. But we as policymakers need to move forward taking that into account, but doing the best for the most people when we have the opportunity to do so. And I think we can do so without entangling religion in it.
Thank you. Yes, and I was only looking for clarity on their position,
Sure.
and so I
Sure.
received that clarity, and which is helpful. I would say that I also appreciate that this bill, I think we maybe lost a little bit of the crux of the significance of this because so many women specifically struggle with things like endometriosis.
Yes.
And that is something that if untreated will cause infertility. And so it is my understanding that your bill allows for that treatment, which is really a significant thing.
Yes, that's right. And I know that when I've worked on similar measures over the years, for example, measures like this were able to garner the support of groups like the March of Dimes, for example, because their sole focus was on improving pregnancy outcomes and maternal health and healthy families, healthy moms, healthy pregnancies. And because of those very reasons, they offered support for measures like this in the past. I'm not sure if they sent a letter this go around or not, but if not, I can circle back with them too.
Thank you.
Any other questions?
Okay.
If
thank
not,
you.
I have a question for you.
Yes, please.
And it is more of a philosophical thing, I think. And
Okay.
we find ourselves in this odd season of life where we're kind of going through redetermination. We anticipate those numbers are going down by some amount in terms of those who are on Medicaid and those who will be shifting off of Medicaid. One would suppose that means there are more Medicaid dollars available once that takes place, not just with this bill, but with all of them that really come and touch Medicaid in some way,
Yes.
shape, or form. We're struggling with this issue
Yes.
of saying we find ourselves on shifting sand at the moment. And so how do we find numbers, whether it's 194, 195, higher, lower, so on and so forth? Can you just kind of speak out loud about that wrestling match that we're all kind of living with, I guess, for the sake of people who might be watching?
Yes, thank you, Senator Hardin. I appreciate that question. And I think it's important to look at this in context, the larger picture which you're painting. Critical work support programs like Medicaid are meant to, of course, meet the basic humanity and dignity inherent in each of us, right? To make sure that those who are without can still access basic healthcare services, right? That's an important component of how we treat each other as neighbors in this society. But that also being said, whether it's the income eligibility guidelines or other eligibility factors, we typically don't see these work support programs as things that are going to be in place forever and ever and ever and ever. They're meant to kind of provide an opportunity for a family to maybe get their head above water, maybe get back up on their feet as they work up a ladder of economic opportunity, right? So whether it's food stamps, the SNAP program, whether it's Medicaid services at any different level of eligibility, these programs are put in place they're meant to be kind of a temporary assistance to help people who've fallen on hard times kind of right the ship, kind of get back into a fuller participation in the economy and make sure that the family doesn't suffer when they're mired in those circumstances. But they also, of course, in order to ensure eligibility for many of these programs, there's work requirements and otherwise. They differ over different programs. But that's important to remember from my perspective is that what these programs really do is that they subsidize sub-poverty wages and jobs without benefits in many instances. So what that does is it puts a lot of pressure on state taxpayers to pick up where private employers should be in many instances. So when you look at kind of where these different eligibility thresholds are set, it's usually based in kind of a determination of policy about kind of where those levels might be to do the most good for the most amount of people. I know that the federal Medicaid expansion, of course, was tied very closely with the Affordable Care Act and was meant to work hand in glove with that and gave states the option to move up their eligibility at those income thresholds. So that was what was presented to the vote of the people a few years ago in Citizen Initiative. That's what this body has implemented. And then there's different types, little niches in Medicaid where we have a slightly higher eligibility because we want to bring more people into the fold for health reasons, like pregnant people, for example. We want to make sure that folks that are pregnant in Nebraska, we cover them at a little bit higher eligibility.
Okay.
Is that helpful?
Thank you.
Okay.
We did have 9 proponents in letters, 1 opponent, 1 in the neutral.
Very good.
Thank you very much.
Thank you. Have a good weekend, everybody.
With that, we close the hearing for LB 333, and we will move on to LB 291.
I'm just thinking of hard one.
With one of our own. We're always hardest on our own kids.
Oh, boy. And you can be as hard on me as you want on this one.
Good afternoon, Vice Chair Hardin, members of the Health and Human Services Committee. My name is Michaela Cavanaugh, Machaela Cavanaugh. I represent District 6, West Central Omaha, Douglas County. I have introduced this bill several times. The first time I introduced a version of LB 291, it was a broader bill. It included implicit bias training, which is what this bill is,
Medicaid postpartum up to a year, and doula services. After that hearing, which I'm not gonna lie, was a little bit of a mess. It had something for everyone to hate. I started taking it apart in pieces and working on each piece individually. This year, we in this committee saw Senator Wishart brought the piece that is the Medicaid postpartum, and we am grateful to everyone, voted it out unanimously. So now this is the piece about the implicit bias training. And it's going to have opposition because, and I want to point out, and I know that they're coming, and they do all the time, and I appreciate it so much, and especially their consistency. The Nebraska Medical Association opposes this bill because it directs them what to do. My intention in bringing this bill is to continue to elevate the conversation about the need for having implicit bias training in our maternal health specifically. I want to improve healthcare outcomes for Black mothers. That's at the end of the day what I am trying to do. That is where we have the greatest disparity, and that is why I keep bringing this bill. Black mothers in the United States are more likely to die during and after childbirth than Black mothers in any other developed country. The United States Center for Disease Control and Prevention statistics show that Black and Native American mothers die of pregnancy-related causes at a rate about 3 times higher than white women in the United States. Research indicates that as much as 2/3 of these deaths are preventable. Implicit bias plays a part in creating disparities because of a disconnect in communication and in bias and stereotypes that interfere with testing and diagnostics. Now, I understand that there is other opposition that we may hear today. This has not previously garnered the opposition of individuals outside of the healthcare community. But as so many things this year, things that normally kind of flew under the radar as more of a policy conversation are getting a different level of scrutiny. So this bill is not going to advance this year. I know that it's not going to advance. I'm not going to ask that it advance. I am going to continue to work with the Nebraska Medical Association on this. And I hope that those that are coming to testify in opposition that are not part of the medical community keep in mind the intention of this bill is to improve health outcomes for Black mothers and not to create some sort of controversial conversation. This has always been a very straightforward and frankly short hearing. So I hope that the point isn't belabored today, but of course, it is our job and our responsibility to listen to the people and hear their concerns. I will take any questions.
Thank you. Any questions?
Are you sure?
Senator?
Yes.
Share a story with us. What you said you've been at this for a while.
Yes.
So share a story with us or two that kind of encapsulates your heart on this and made you say, you know what, I need to say something about this.
Well, I appreciate that. I mean, since I started here, maternal health has been my passion. I have worked on several pieces of legislation to move the needle on improving outcomes for women in maternal health. And all of the data says that Black mothers have the worst outcomes. And so in order to improve maternal health writ large, we need to focus on those disparities first and foremost. And if we can improve their outcomes, we will improve everyone's outcomes. The stories that I have heard over the years from Black mothers have a lot of times been communication, a misunderstanding, a disbelief of pain, and so pain going undiagnosed, and that pain being a very significant and severe thing that needed to be recognized. And I honestly, I am not an expert in this. I don't know why it is the way that it is. I just know that the studies have shown that doing this type of training helps with the outcomes. And I do think, and perhaps they will speak to it when they testify, I didn't ask, but the Nebraska Medical Association, that the medical community is working on this. This is definitely an issue that they are working on and that they recognize is important. The the opposition has always been that us directing healthcare is not appropriate, which I agree. And I would like to find a path forward that doesn't have us intervening in that and has the medical community taking care of it themselves. But I think it's an important conversation, so I keep bringing it up and making you all sit through it.
Let's see. Have we made any progress in terms of being able to measure it, or?
Excellent question. This committee voted out of committee again unanimously Senator Vargas's bill on maternal morbidity. So we do have a maternal mortality review committee, and if the legislature were to pass the bill that we kicked out of this committee, that would authorize them to also look at maternal morbidity, which would ultimately, ideally, go towards finding some of those health disparities and addressing them proactively and improving those outcomes. So highly encourage that bill moving forward because it will really do a lot of what the intention is here, which is to improve health outcomes.
If you were to put yourself in the other person's moccasins, why is this struggle to move forward?
This particular bill, I mean, again, and I haven't pushed for it to be moved out of committee because I very much appreciate the viewpoint of the medical association in that directing them so prescribed in how to do their work is something that they object to. And I view our role to be more partners. And so I would like them to do this. I think this is something that they are continually looking at and working on. But I personally have not moved this piece out of committee or asked for it to be moved out of committee because of their specific objections. So we'll have a conversation.
Okay.
We've sparked.
Senator Reed, I've got to let your cellmate over here.
Yes.
I'll be nice to her.
Are you going to ask me?
I always am nice to you.
You are.
Oh,
More than I deserve, probably, but.
well, that's for sure. That goes without saying, I think. But, my piece gets to be is all these little pieces, and we've tried and tried and tried for a very long period of time.
Mm-hmm.
I don't know whether it's a question or trying to engage in dialogue here, but I read one that was 20 years ago, and we really haven't made any progress on the poverty piece, and we've spent billions and billions and billions of dollars. Now, I have a particular interest, and I think part of the core problem is, or as we like to use the term root cause, is just Medicaid in and of itself. I think we have to go to a population-based. I proposed one time years ago that we go to a 5-year contract to take of a population group so that you get some continuity. And I'm not a fan of managed care.
A 5-year contract, can you,
If you have a patient,
yes.
you don't give them an option of changing every month. You have a relationship, much like Kaiser Permanente,
I see.
where you see them for continuity and you see their families for 5 years. And you see what you've got.
I thought you were going down a road of socialized healthcare.
Well, we're already on that road, but don't get me started there. But I think some of it's in our regardless of the federal dollars. I just think we've got to come up with some different model. And I like the model of population-based.
I think that's an interesting concept. And having a medical home I think, would improve.
Medical home's the key.
Medical
And
homes
the
improve
use of,
outcomes.
like emergency centers
Yes.
and even clinics at these schools break down that continuity. So nobody knows exactly.
We could make those schools a medical home.
Those schools have their hands full of being a school. They don't need to try to be a hospital. They don't have that skill. They don't have the resources yet.
We'll continue this conversation.
Okay.
You and I.
I think that ends my question.
Any other questions?
But thank you.
Thank you.
Okay. Will you join us for close?
I will be here for close.
Nice. Proponents for LB 291. Anyone in favor? Supporters? Pom Pom Shakers for $291. Anyone in opposition to LB 291? We have a taker. Welcome.
Thank you. Chairman Hansen and members of the committee, my name is John Trapp, John-Trapp. I currently am a pulmonary critical care physician. I serve as Chief Medical Officer for Bryan Health, and I'm President-elect of the Nebraska Medical Association. I'm testifying on behalf of the Nebraska Medical Association in opposition to LB 291. Given Senator Cavanaugh's comments, I probably will abbreviate this because I hear the focus really is on perinatal education. So I actually think we can work closely with Senator Cavanaugh on this topic. The NMA does not oppose the idea of implicit bias training and awareness for health professionals. Actually, it's quite important. But as physicians and leaders in medicine, we are committed to optimal health for everyone and are working to ensure that all people and communities reach their full health potential. However, the NMA is opposed to mandates for specific content in continuing medical education for physicians. Physicians in Nebraska are currently required to complete 50 hours of approved CME each biennial licensure cycle. Currently, this does include 3 hours of controlled substance prescribing and a half hour on the Prescription Drug Monitoring Program, or PDMP. Additionally, as of this year, physicians will complete mandatory education requirements to hold their DEA license. This is their drug enforcement license. This year, physicians renewing a DEA license will be required to complete an 8-hour course on pain management and the treatment of patients with substance use disorders. And finally, physicians complete additional hours related to their board certifications and their specialties and subspecialties, which typically accounts, could be hundreds of CME hours, depending on how many boards that you maintain. Legislative mandates requiring specific training requirements place further burden on our physicians to complete, track, and report participation in yet another training course, and often is a almost check the box type education. This takes time away from physicians' other training and caring for patients. So the NMA gladly continues to support efforts to encourage implicit bias and DEI training available to Nebraska physicians and other healthcare providers. Specifically in Senator Cavanaugh's comments about perinatal quality, she actually may get some of what she wants with this. Currently at Bryan Health, we are working to get additional perinatal certificates for quality of care. We get this through our accreditation agencies, through CMS and Joint Commission. And to achieve these special certificates, you actually have to complete this training. So it's almost a requirement already. At Bryan Health, we just had a session because we are pursuing that actual certification for perinatal quality because of exactly some of the concerns in gaps in care that are identified, that implicit bias training is really important. So that is actually part of that certificate. And I think it was 3 hours of implicit bias training. So many of our team have already gone through that first phase to get that additional higher level certificate. The comments that Senator Cavanaugh makes with regard to the gaps in care for some of our patients that are culturally different, no question, really important to identify those gaps. Those gaps are real. We need to close those gaps. We're working on a blood pressure initiative at Bryan Health. And again, I mentioned Bryan Health because I'm familiar with that, but these are worked on at other hospital facilities to really close the blood pressure gap, making sure that we close gaps with regard to cultural, language, ethnicity, to make sure that we're doing a great job on just blood pressure checks and access to care. So lots of opportunities to partner with Senator Cavanaugh on exactly these topics. So we do appreciate Senator Cavanaugh's passion for this subject. We agree it's important to address health inequities within the state. But again, we remain opposed to mandates of specific education content that's required on an annual basis. Thank you. Happy to answer questions.
Thank you. Senator Reapy.
Thank you, Chairman. I've read some recently where some of the medical schools are moving away from enrollment or selection of students for medical school from merit over to diversity. I want to get this right, equity and inclusion. My question gets to be, at the end of the day, at the end of the graduation, do those recipients of that care actually receive better care based on sensitivity based on merit and ability.
Again, I'm not.
Because that's the outcome.
I'm not in an academic medical center where I'm actually recruiting those medical students and interviewing those, but I think the interview process and selection of medical students has changed. Perhaps many years ago, it was based on your grade point average and the brightness factor and how you scored on an MCAT test that got you into medical school. Now they're very much looking at the spectrum of care, that communication is important, empathy is important, awareness is important, self-reflection is important. So I think they're really looking at a different medical student who's able to deliver healthcare in a way that's really going to connect with our patients. So I do believe the selection of medical students has moved from simply achievement on certain tests and GPA to a different, well-rounded type of a physician for future delivery of care. I don't know if that changes the gap, but I think it's going to change who your physician is in the future.
I spent some time at a hospital, St. Vincent's in Columbus, Ohio, and we were fundamentally in a Black community. And I saw some of the very competent Black physicians who experienced discrimination from, in this one case I recall, from a Black professor from Ohio State University. Wouldn't let the Black surgeon, because he said, son, you may have gotten through on affirmative action. So I think we have to gently go after this thing. I'm not saying we don't all, including me especially probably, need to be more sensitive, but it also has some backlash for the very competent individuals who could make it without it.
Competency is a complex word, and competency, we want competent physicians. We don't want individuals to go through training and get special passes. This is about you maintaining a broad diversity of types of physicians from all cultures, ethnicities, languages. Delivering that competency, we think we can achieve that level of competency so they can deliver great care. And I agree, competency is really important, and we should expect that and continue to deliver that as physicians.
Okay, thank you, Mr. Chairman.
Thank you. Any other questions? Seeing none, thank you, thank you. Anyone else in opposition to LB 291? Welcome.
Good afternoon, Senators. My name is Linda Vermooten, Linda Vermooten. Thank you for making the time available for us to come and speak to you today. As a professional that's licensed in the state, I have multiple licenses in the state for which I'm required to complete multiple CEUs, different requirements for each. And I'm not opposed per se to learning more, although I feel that I have a pretty good grip on a lot of diversity, more than average American. I'm trilingual and can converse in basic conversation about 15 additional languages, have lived on 3 continents. So I think I bring a lot of diversity to the table and understanding that. So when I'm looking at this and I'm saying I have a limited amount of CUs that I'm required to take, but if I'm required to have to take some, it's a mandate. I have to take ethics for one. I have to take substance abuse for another license, and the care of those particular individuals. I think we need well-rounded people, but when we begin to mandate, where do we draw the line? See, now we're looking at this. We want this included. And then maybe a few years down the line, we want that included. That's how we had to have the ethics included with one license and the substance abuse with another license. So it becomes a burden to the practitioner that's just trying to give good care to the clients and the people that are sitting before them. And so I would just caution us in when we're looking at this and we're saying there's a mandate required, that becomes a challenge. I think all medical professionals are quite happy and we do engage in continuing education because to stay current, things are changing so fast. You can't even just keep up with the amount of reading, let alone all the research that's out there in so many different aspects that pertain to your licenses. But when you're saying I want to mandate the kind of content that you required, then I think that becomes a problematic for me, because I'm saying, are we pushing a certain way of looking at things, a mindset of way of looking at things? Are we taking minority views and wanting everyone to look at and see things the same way? And I think then that becomes problematic to the majority of the practitioners that are in the field. So I would stand opposed to that. Thank you very much for your time.
Well, thank you. May I ask, what are some of your certifications that would require you to get all of these different CEUs? What do you do?
Well, I'm an RN. So to the RN license, they added the mandatory working with people with substance abuse.
Yes.
I'm also licensed as a mental health practitioner and independent mental health practitioner and a psychological assistant. So trained as a clinical psychologist. So they've added like ethics to those, and each, every few years we're adding on more and more and more. Well, where does it stop? Nobody is paying for those except the practitioners that are just trying to give good care to the individuals. So I think I spoke much more broadly than what I had jotted down on the paper.
Well, thank you. Any questions from the committee? And forgive me for being snoopy, but where did you pick up such amazing linguistic skills? Speaking all of these different languages.
Well, I grew up in South Africa, which is a bilingual country.
Yes.
But there's actually 16 major languages in South Africa alone. There's Xhosa and Sotho and Zulu and Pede and Vende. And then I lived in Europe. So if you live in Europe, you're going to pick up multiple languages. Dutch is my third language. And so I can converse a little bit in German and French. Yeah.
As someone who struggles with Duolingo in one language, I admire that. So thank you.
Thank you for your time, Senators. Have a good day.
Anyone else in opposition to LB 291? Welcome.
Thank you. Okay, my name is Marilyn Asher, Marilyn Asher, and I am not a medical person, but I have great concern for the First Amendment rights of Nebraskans, and I feel that this bill poses some problems for that. Laura Morgan, a registered nurse, lost her job during 2022 because she would not mouth the words that she was a racist. She was fired for refusing to take implicit bias training, claiming that states across the U.S. are forcing healthcare professionals to make false confessions of racism, and that she refused to go along. After 39 years of providing equal care to all my patients without regard to their race, I objected to a mandatory course grounded in the idea that I'm racist because I'm white. My objection is to mandated training for implicit or unconscious bias because the material in those courses is intended to tell healthcare providers what to think instead of how to think, said Morgan. Laura could have insincerely mouthed the words and could have gone on about her business, but she was not about to take part in forced confessions. Policymakers don't seem to be considering the unintended consequences of these mandates, Laura said. Accusing my peers and me of racism will contribute to soaring levels of burnout, causing many to leave the medical profession. Some, like me, will surely be forced out. Patients, especially minorities, will experience the most harm. This week, I was reading a book by F. Olin Stockwell, a Methodist missionary who was imprisoned in Chinese communist prison camp from 1950 to 52. On the same day that I was going to write this speech, I read what he said. He said, "The communists insist upon confession. Because it is all done under a ruthless dictatorial compulsion, the confessions are often shallow. They are often but superficial attempts to conform to a new pattern. When confession is honest, denoting a real change in thought and attitude, it is transforming." Here are some questions we need to answer before passing LB 291. What determines that only medical professionals are required by the state to take training? What other professions will soon be required to do the same thing? Who in the state determines the subject matter that needs to be addressed, such as diversity, equity, and implicit bias? Could it possibly be a state senator that on one hand demands that this training be given so people are treated fairly, and on the other hand threatens to burn down the legislature so the second house may not receive legislation? Does LB 291 encourage or curtail our individual inalienable rights of life, liberty, and the pursuit of happiness? Dictators insist on subjecting entire populaces to subjective whims that curtail these inalienable rights, and most of the global population does not have those rights. LB 291 invites us to join them. And if the trained professionals fail to think the way they are trained, by what mechanism will they be judged? Who will be the monitor of their thought life, and who will pay for the adjudication? And how much will it cost? I will tell you how much it will cost. It will cost our life, liberty, and the pursuit of happiness, and that is not worth giving up. Thank you.
Thank you. Questions from the committee?
Okay.
Seeing none, thank you.
Thank you.
Anyone else in opposition to LB 291? Welcome.
Thank you, Senator Hardin and other senators on the committee. My name is Steve Davies, Stevedavies, and I testify in opposition to LB 291. And Senator Cavanaugh, I laud your goal and hope we can make progress. And I testify in the vehicle to attain that. The stated objectives of diversity, equity, and inclusion seem laudable, but the results of such training bring more angst, division, and unhappiness. Grade school children come home believing that they are evil. And to quote part of the article by Peter Bregman in the Harvard Business Review entitled, "Diversity Training Doesn't Work," when people divide into categories to illustrate the idea of diversity, it reinforces the idea of categories, which, if you think about it, it is the essential problem of prejudice in the first place. People aren't prejudiced against real people, they're prejudiced against categories. Sure, John is gay, they'll say, but he's not like other gays. Their problem isn't with John, but with gay people in general. Categories are dehumanizing. They simplify the complexity of a human being. So focusing on people, on the categories, increases their prejudice. The solution, instead of seeing people as categories, we need to see people as people. Stop training people to be more accepting of diversity. It's too conceptual and it doesn't work. And that's the end of the quote. Since we began this process of enlightened education, our society has become more divided, angry, and less civil. An organization has polled the University of Minnesota every year for 20 years and found the level of unhappiness of students has been increasing as DEI has become more instituted. The idea of equity is a major concern. Our nation was founded on the equality of the individual. It purports to provide a level playing field for all. Equity is the antithesis. It jumps to the outcomes and seeks redistribution to equalize the results. It is Marxist and socialism masked as being fair in a Christian way. Even St. Paul, by inspiration, commanded the Thessalonians, if anyone does not want to work, he should not eat. And I'm going to insert a verbal paragraph here. Position and standing equity is also problematic. You see the military, airlines, universities, medical schools, all lowering standards to meet a diversity goal. There are major city schools nationwide that aren't grading students anymore. And there's a school in Virginia had at least 2 national merit scholars, which greatly enhances their scholarship ability and acceptance into the universities. They didn't tell the students or the families. They hid it because they didn't want anybody else to realize someone had achieved something. And when we get on an airplane or go in an operating room, are we concerned what the person is that's doing it or their skills and talents? The zenith of DEI, an example could be our current administration. We have a VP whose greatest achievements may be photo ops and an awkward laugh, a challenged press secretary, a secretary of treasury who a year ago stated inflation would be transitory, a secretary of transportation who went on 2 months parental leave as container ships stacked up in the Pacific. The head of nuclear waste disposal had to be let go for multiple thefts of women's luggage at airports, and the Secretary of Homeland Security declaring the border is secure as 5 million non-citizens into our nation. The types of programs that have been instituted to increase diversity, equity, and inclusion have exacerbated perceived problems and greatly eroded our cohesiveness as a society. They do not belong in certification programs or schools and businesses. Thank you for your time.
Thank you. Questions? Seeing none. Thank you, Mr. Davies. Anyone else in opposition to LB 291? Anyone in the neutral for LB 291? Feel free to come back, Senator Cavanaugh. We did have letters, 14 proponents, 102 opponents, and 1 neutral.
Wow, I feel popular. I mean, I appreciate everyone coming and sharing their views. The intention of implicit bias training is not to make anyone feel bad about who they are. The intention is to improve health outcomes, specifically for Black mothers. Again, we know that for whatever reason, and I am not an expert, I don't know what the reason is, but we hear time and time again that there is a disparity in how Black mothers experience their pain, especially during all things pregnancy, which can be so much fun, and how they are treated, and specific pain going undiagnosed or being diminished can result in some pretty serious complications and has historically. And so that is not to say that anyone is ill-meaning, ill-willed. I think our medical professionals, especially those that go into obstetrics, are wanting to serve their patients. And sometimes we just need to, take a look at how we are addressing specific situations. I know for myself, when I was pregnant with my second child, I foolishly, some might say, went to Pierre, South Dakota when I was 36 weeks pregnant for my cousin's wedding. And I pulled my stomach muscle. And that, yes. And I had a 14-month-old who insisted on being carried around, and I pulled my stomach muscle, and it was addressed immediately, and I figured out what I needed to do and all of those things, and it wasn't a threatening position. But I think of the pain that I was in that moment, and I appreciate that my doctor trusted me in my pain, helped figure out the cause of the pain, and it was addressed. And so it's things like that just, you want to make sure that we are providing the best quality care at all times. So it is not my intention to make anyone feel bad about themselves or to be called racist or anything like that. It is just to improve health outcomes. I appreciate the Medical Association for coming in and, first of all, for being consistent in how they come in on bills. And I will continue the conversation with them in how we can improve health outcomes. And I want to thank this committee for the work that we have done this year to advance bills that do improve health outcomes for mothers, which we've already discussed: postpartum, Medicaid expansion, and the maternal morbidity review. And I just keep wanting to say thank you for getting those bills out unanimously out of this committee. Bunch of softies here. And I am grateful to work with you as a result. So I'll take any questions.
Questions, anyone? It looks like we are complete.
It's
Thank
our
you so
Friday.
much.
Thank you.
This closes the hearing for LB 291. I believe we're moving into executive.